speech was very interesting. The main topic was about the telemedicine. How can Futercare involve with that telemedicine?
Well, telemedicine really gives captains and first officers access to a doctor and medical advice at sea 24 hours a day, 7 days a week, 365 days a year. So if a crew member becomes injured or ill, then the captain can speak to our team of first responders and nurses and doctors and get medical advice. And this prevents the need for a medical evacuation. Quite often now, because diagnostic tools on board the ship have become so advanced, our remote doctors can really see via iPads or medical apps what is wrong with that crew member and can help manage his health care until he arrives at the next port of call, whereby then we can book him into the right hospital and manage his treatment. Telemedicine literally saves lives because you have crew members at sea, they don't have a doctor on board, the captain is only trained really in first aid. If someone gets ill, they need medical advice and they need someone to really see what is wrong with that crew member and the kind of doctor he needs to see. No, it really is very inexpensive actually. When you join our Caring for the Crew program, you just most of the correspondence is done by email, goes straight through to our first response team, who then asks some questions about the crew member, try and identify exactly what's wrong with him. And now that they have very easy computerized systems, which the doctor can see the patient, see the crew member face to face, and can quite accurately diagnose what is wrong with him. So it's not expensive to use that, but you give him a much better level of healthcare on board, and the ship owner saves money because he doesn't have to make all these unnecessary emergency evacuations. In 98% of the cases, an emergency evacuation is not needed.
So, more details about how important is this telemedicine, how it can help to save money or anything for the ship owner.
Yes. Well, not only with telemedicine, but now we are actually starting a very data-based approach where we analyze all the crew members' health data and building databases for the ship owner. And we look at their PEMI information, we look at their chronic conditions, we speak to them about their healthcare issues, and we put this all into a database so the ship owner can really start to see his crew members, what health issues they may have, and so that we can put in programs to proactively look after these crew members on board. So this proactive approach also very much helps to control health on board and to, improve the health care of our crew members.
And about Futurecare, how can support this generally the health of the crew members?
Yes, not only by providing assistance at sea, but also at portside. We have an international network of clinics and hospitals all over the world where we know they're good clinics and who we have worked with to negotiate better rates on behalf of the ship owner. The huge issue really with ship owners, they are being overcharged in port hospitals around the world. If they work with Futurecare, they will not be overcharged because we make sure that we only use facilities that are charge them the correct rate and normally also reduced rates because they're working with us, and this makes a huge difference. It can make a huge difference in the medical costs overall.